Thanks for joining us for another edition of the Chapters Health System Q&A. Joined today by Allyson Moskowitz, the Director of Social Services, Volunteer Services, and Bereavement Services. So no shortage of hats that you wear here at Chapters. Thank you for joining me today.
Oh, you're welcome. Thank you for having me.
So going to touch on a few things today. All of this, kind of how COVID-19, coronavirus is affecting our lives and our operations here. Bereavement services is certainly no stranger to that. A lot of things have changed. What are we doing? What are we still offering? How has it changed?
We are still offering our full bereavement services. We're just doing it a little bit differently right now. We have all of our bereavement staff still working, and we are doing individual counseling visits over the telephone, over Zoom, sometimes Facebook, and then we are doing our group supports the same way. So all of our support groups have continued. We're even doing children's camp at home, if you can believe that.
Yeah, I've actually had the pleasure of being involved in a little bit of the distribution of that. I think campers are really gonna enjoy what they see. A little disappointed that camp's gonna be postponed a little bit, but I certainly think it's the next best thing.
Yes, they've loved it so far. And we have been able to reschedule one camp. Mm-hmm. Our Life Path Hospice Camp has been rescheduled for August, and we are working on rescheduling our Good Shepherd Camp. So we hope to do that.
That's great to hear. Shifting the focus a little bit, we're starting to see deaths either caused by coronavirus or not. And you can't be by your loved one's side in their last moments. You can't, visit your grandma or your mom or dad one last time. And then you can't be there, have a proper funeral. How can we process that?
Oh, it's very difficult. And first, just let me say, grief is difficult by itself. Grief is difficult on its own. And then we have the complications of things happening today that can really, really make it difficult. But I think we have to remember that no matter how we do it, we still have to grieve. What I've been hearing lately is that people are not having funerals because they can't get close, they can't have big family gatherings. And we would really encourage you to do as much as possible utilizing social media, Facebook, the telephone. We want people to still have a funeral because funerals are important. When people we love die, funerals are very important. They help us accept the reality of the death. So even if you can't have a big funeral with all the family that you were planning, have a small gathering over the telephone, write letters to each other, post memorials on Facebook, anything you can do, picture slideshows over social media, over video, email. But it's important for people to connect at this time, even though we've got a lot of barriers in our way. And unfortunately, survivors are not, I should say family members, Unfortunately, family members sometimes are not with that person when they die. That's extremely difficult. And our funeral homes are working with families too. They'll have guidelines to keep families safe, so perhaps families can visit at the funeral home. We do know from the Center for Disease Control right now, there is very little chance of contacting coronavirus from someone who has already died. So families can be encouraged to share the same room with that person if they did not have coronavirus. So there are lots of ways that a family can spend time with their loved one, maybe not like they want to, but it can still happen.
Mm-hmm. Do you think it would help or make sense to almost have two memorials, maybe one now, like you said, just over Facebook or Zoom or anything, and then a few months down the line when hopefully we can all be in the same room again, Would that be helpful?
Absolutely. I think it's important right now for people to do something right after the funeral, because that gives people a sense that their loss was important and that the loss really did happen. But family members from other states or other countries are not going to be able to attend. You might not have the songs and the readings and things that you would normally have. So I would say absolutely plan your big funeral for several months down the road when we're able to do that. But for now, plan something small with just family. It doesn't even have to be in the same room. It could, again, like you said, Pat, it could be over Facebook, email, phone, but something just initially for the families to acknowledge the loss. And then later, a couple months, have the regular funeral.
I like when you suggested handwritten letters. Seems like we've lost a little bit of that in recent times. It's nice to receive a handwritten letter.
It is.
We're now getting into the time of year, obviously Passover, Easter, where our holidays are affected by this. We can't do the big celebrations, go to the religious buildings and celebrate there, have family over. What can we do in those scenarios to still celebrate?
Absolutely. I would encourage people to still celebrate. The holiday is occurring, and we all want to celebrate. And do what's meaningful for you. If it's just you and your family in your same house, celebrating a meal. I've heard of people having virtual Easter egg hunts. I would say keep your family traditions. Keep the traditions that you have always had. They're going to look very different, but do what you can within your own family unit that's living in your house.
Fantastic. Just to kind of wrap it up, again, like you said at the beginning, all of our services still offered.
Still offered.
Just a little differently.
Yes.
Phone, FaceTime, Zoom.
Yes.
All that stuff.
Absolutely.
So how can people get in contact? Just call or email their normal bereavement specialist?
Exactly. Call, email. We're still on the phones. We're still manning the phones. We would love to hear from you if you have questions or just need some help. So yes, call your local Life Path Hospice, Good Shepherd, or HPH Hospice.
All right, we'll include those contact details in the video description for everybody. Allyson, thank you so much.
Thank you. Happy Easter, and let us know how we can help.
Thanks.
Thank you.